treatment. This week is Burn Awareness Week, really all across the country. It really is a way for businesses and organizations to talk about ways to prevent burns. I would assume kind of deal with the aftermath of burns as well. Today we're joined by Dr. Timothy Novosel from the hospital to raise awareness that what's happening this week. Again, this isn't just about people watching television, raising some awareness to keep them safe. It's about organizations and healthcare organizations as well kind of go, you know what, we need to take this seriously.
Oh, absolutely. Yeah. The burns overall have decreased across the country, but still a significant problem in the United States. And it's not just simply the burn itself, it's the rehab and all the other resources that go into it. It's a devastating issue for a lot of people.
Because so often in the news we say someone was burned over 20–30% of their body and it kind of becomes a toss away and on to the next story. But someone who's dealing with burns over 20 and 30% of their body, specifically when you talk about older folks, that can be truly debilitating, not only with physical scars but emotional ones as well.
Absolutely. That anything over a 20% burn is considered a severe burn that requires debridements and surgery, but the rehab, these patients actually have problems and issues over years.
And I'm learning, just in reading stuff on the internet and the stock market and things like that, artificial skin is something that's not high-tech in the movies anymore, like a science fiction movie. A lot of that is coming to the forefront as well, right?
The use of cultured skin, there's a cultured skin, there's actually spray-on. There's some things that are actually in experimental phases, so it's really interesting and fascinating issues.
So for people watching television this morning, what's the one takeaway you want them to get from this as they go about the rest of their week?
I think the big thing is prevention. Being aware that you can get burned from almost anything. The big percent of burns we see, that the less severe ones, things we see are little kids pulling down coffee cups on them or hot water. They're using the microwave and they splash on them. That's one. Another area of burns we see is people just not thinking about safety, about fire, grilling, that kind of thing. So,
and a lot of people don't think about the typical sun that's up there in the sky as well, because depending on how long you've been out there, that can be very significant as well.
Yes, my wife would be upset if I don't talk about melanoma and skin cancer. She's a dermatologist. So yes, that's a huge portion of what we see.
All right, doctor, thank you very much. We appreciate the tips. We are back in a moment.